And the more that the news started coming out with what COVID was and how it is, well, like what kind of havoc it was wreaking on the world and how fast it was spreading, it kind of scared us away from trying.
When the pandemic began, Samantha worked from home and took care of her toddler after his daycare shut down. The uncertainty of the pandemic, health risks, and excessive stress took a toll, and she and her husband decided to delay their plans for a second child.
It's super exhausting for the both of us. So we couldn't have found time, even though that we were both home.
A Statistics Canada report found in 2021, nearly 24% of Canadians changed their fertility plans due to the spread of COVID-19. Obstetric Dr. Tally Bogler says uncertainty was a big factor.
The economic uncertainty, the general uncertainty about the future, and fear of COVID-19 infection and pregnancy.
She says many avenues for support were also disrupted.
The system was overwhelmed. Fertility clinics were closed. All the pregnancy supports that typically exist were disrupted, like prenatal classes and breastfeeding supports. People were afraid of having family members come into the home to help.
According to a global Ipsos study, financial concerns were a top reason why many people delayed plans for a baby. Wealth advisor Jeanette Power says financial planning is key before having a child.
Daycare costs in 2020 were an average in Toronto of $1,600 a month. You can imagine if you have 2 or 3 children, how quickly that adds up. Educational planning, you may need to upgrade your vehicle and you may need to upgrade to a larger living space.
Power says budgeting is not meant to discourage you, but rather show you the areas where you can save and set you up for success.
That's prudent no matter if we're in a pandemic or if we're not.
Sharmeen Somani, Global News.